We're going to move on now to Laura Gould from NYU Langone here in New York City. And Laura is going to be talking about her cutting edge work with us in helping prevent sudden infant death in children. So her talk is titled Improving Our Understanding of SUDC Through Video Analysis. Okay, Laura, all yours.
Thank you so much. Thank you so much for inviting me, Natalie and Nanit. It's a pleasure to be here and really interesting talk so far. I wanted to talk a little bit about how we're using video analyses to better understand SUDC. And you might start off right with, I don't know what SUDC is, and I would not be surprised because the first definition of sudden unexplained death in childhood, we just defined it 20 years ago. Now that we're in 2025, I can say that. And you may be very familiar with sudden infant death syndrome or sudden infant death, which is much more common, but unexplained deaths on or after the first birthday do occur. The statistics in the United States are about 1.7 per 100,000 toddlers in this group. And these deaths are unexplained after a thorough investigation, and that would include a complete autopsy, including review of the medical history and appropriate ancillary testing. And it also goes to the point similar with SIDS, is that there are certain things that the standard autopsy procedures of today have a very difficult time with identifying. And two of those things have to do with electrical disturbances, whether it's an electrical disturbance of the heart or of the brain, like a seizure event or a heart rhythm problem. On autopsy, those organs look normal. So it's difficult to impossible for the investigator to prove what happened. The other complicating factor is that, like sudden infant death, these are over 90% are unwitnessed and sleep-related deaths. And this is how my initial connection with Nanit occurred. So I'll give you a little bit more background on what SUDC is to explain this project that we have just recently launched. So I know we have an international audience, but in the United States, our leading cause of death charts look like this. This reflects the leading causes of death in children 1 to 4 years old in 2022. And when you look at these, you probably are not too surprised at some of the things you see on this list. Issue with surveillance and awareness with unexplained deaths in children is that the codes that those eventually go into from a vital statistics point of view are not included in our leading cause of death charts. So if we added those in, unexplained deaths in children age 1 to 4 are actually the fourth leading category of death in 2022. So it's a significant problem, but we also have this issue with awareness and surveillance of them due to the varied death investigations and, like I said, the difficulty of accurate certification. We also have the complicating factors of there's other things that can cause sudden deaths and the challenge to the death investigation system. Epilepsy can occur at any age. We see the infant deaths and we see the SUDC range from 1 to 18 years throughout childhood. We also see something called febrile seizures, which I'll explain just in a minute, which is defined as or the age group for febrile seizures is between 6 months and 5 years among most definitions. But when we're thinking about SUDC, the majority of them are happening in toddlers in this age group that overlaps with the highest risk of febrile seizures. So about 10 years ago, I came to NYU Grossman School of Medicine and started this new registry looking at sudden deaths in children with Dr. Oren Davinsky, who's a pediatric neurologist and epileptologist. And we started collecting cases, families enrolling in our studies who had experienced this tragedy, and we're looking for more answers and trying to help the future, trying to help us learn from these tragedies so we could prevent it in others. So you'll see a lot of the information off to the right in terms of the vast amount of information and quality data that we collect on each one of these tragedies. When a case is enrolled, we collect all of this information and we digest it and we organize that information for reviews through our multiple co-investigators. We have about 36 researchers from many different specialties, trying to get an assessment on this different information we have. And then we report back results on our opinions to the families, whether it's genetic analysis results or the pathology review process in terms of giving back to those families. So as of today, we have, I think it says 387, it's blocked on my screen, that we have enrolled in the project. Our goal is to review 400 cases. And you'll see that there's a bit of a male bias that we see. And we also see that in sudden infant death. And you also see that over 80% of our cases we enrolled are in those toddler years between 1 and 4. And you'll see the race breakdown. You also see down there in red is this association. The strongest clinical factor that we've seen in these cases is a history of febrile seizures. So let me explain to you what those are in a little bit more detail. But febrile seizures are common. In the United States, about 3 to 4% of all children will experience a febrile seizure between the ages of 6 months and 5 years when they have an illness or a fever. And they're considered benign, except for a slight increase in a risk of epilepsy in children who have a particular type of febrile seizure called the complex seizure, which you see outlined on the right. And what is important about these is that in the general population, we're seeing them 3 to 4%, but in the cases we're enrolling, we're seeing almost a 10-fold increase. And so it concerned us early on, and we thought, well, maybe this is just a case ascertainment issue, right? We're not a population-based study. Maybe we're getting a skewed case ascertainment. But we've seen this association repeated now in several different data sets around the world. So we do think it is a real association, but trying to understand what this means and learn from them has been a challenge. So all of our sudden death cases provide us a lot of information and allow us to do a lot more experiments with them, and 2 of which are studying more about febrile seizures and video analyses. Since we have enrolling cases now for over 10 years now, and Nanit is an exact example of the technology that has increased over time. So when we first started the study, one of the questions that I always ask during the family interview is, were there any devices operating in the child's room at the time of death? And we saw, this process. It was a sound monitor. Okay, now it's a video monitor. And then it was a recordable video monitor. And over time, I guess it was inevitable that some of those children were the children that were enrolled in our study. And we collected 7 of these videos prior to the publication of this paper that came out last year. 2 of them were on devices that were motion or sound triggered. So we had like little 10-second spurts of information that was hard to make sense of. But 5 of the videos that were continuous all showed convulsive events prior to the last signs of life of the child. And I know this is very, very heavy and information in this forum based on what I've seen and other things. But I think that the fact that the vast majority of these children are sleep-related and unwitnessed, we can learn so much from sleep data and devices like this that are out, that we need to do this. This is the next frontier. And these deaths have been so mysterious and unexplained for so long that we can learn more. So our question that I spoke with Natalie about was, well, what can we learn about living children with febrile seizures? We know what the videos look like in terms of the cases enrolled, but with 3 to 4% of all children having febrile seizures, more people using recordable cameras for sleep supervision of their child, there must be children who have had sleep-related febrile seizures, and the majority of them do just fine. What can we learn from them? So we obtained a small grant from the American Epilepsy Society to create a registry of these types of videos. And the goal is to collect 200 febrile seizure videos and 200 controls, and then store them in Databrary to not only allow our research at NYU, but also to provide this information to others that may be interested in studying this. So our long-term goals are to identify what are the characteristics of sleep-related febrile seizures in living children. And from those, by comparing them to the SUDC videos, can we identify risk factors of those seizures associated with sudden death? But can we also identify protective factors and how much this information could not only help clinical care, but could also guide these technological devices like Nanit. So our registry at NYU has a lot of different people on it that help bring this about, and everything we learn leads us to our next research question. So I want to thank all of them and the families that we work with, including the Nanit customers who have now enrolled in our study. We've enrolled 31 families, and hoping that their children don't have more febrile seizures, but if we do, that we can collect that information and study it for the greater goal. But thank you very much.
Amazing. Thanks, Laura. Let's just keep that slide up for a little while, Mackenzie, because I
Yeah.
just wanted to give a little plug to your study, Laura, and just say to anyone, if they have anyone in their clinical practices that have families with a history of or children with a history of febrile seizures, we're looking to recruit more families for this study. So if anyone wants to participate or has families that may be interested, they can contact Laura at her email address here.